Hello, and welcome to the next Digital Care Homes training session, Clinical Video Consultations for Care Homes. This session provides further information about video consultations and how to join them, using examples of Accurx and Attend Anywhere. There are many benefits to carrying out video consultations. They allow for remote consultations between a patient and clinician in real time. It's a safe way to communicate during COVID-19 with a GP or consultant, and it's simple and easy. It provides an additional way to access and communicate with the GP or consultant and will help support your residents' health needs. Using video technology rather than a phone call for a consultation is helpful to be able to pick up on visual cues. It's not exactly the same as a face-to-face, but the clinician will be able to see the resident's expression and movement. It can be used for ward rounds in care homes or for multidisciplinary team meetings. However, Microsoft Teams is a really good facility for this, and we will cover this in our other training sessions. Finally, the GP can see up-to-date patient records in real time, like they would if the resident had gone into the GP surgery. To join a video consultation, you will need a device that has a camera and microphone, so a laptop, tablet, smartphone, or computer. If you are using a mobile device, please make sure it has enough charge. You'll also need to make sure you're in a quiet and well-lit space where you won't be disturbed. When carrying out video consultations in a care home setting, be aware of who is around when a resident's care is being discussed. You need a good internet connection and a modern web browser on your device, preferably Google Chrome or Safari. Please note there are no apps for the video consultations detailed in this presentation. They are all completed via an internet browser. You'll be sent your video call appointment time and all the information you will need to access the appointment via an email, text message, or letter. You may also receive a reminder message leading up to your appointment. To get the most from your video consultation, it's a good idea to make a list of particular questions or issues you'd like to discuss in advance of the call. To start the call, just click the link you have been provided in the email or text message, and we'd advise doing this a few minutes before your allocated appointment time. You may be asked to confirm your date of birth and a phone number. This is so that you can be called back if you get cut off during your appointment. Your doctor or nurse will join you on your call as soon as they are ready. Remember to look at your doctor or nurse's face on the screen whilst you're talking. There's no need to look directly at the camera, and make sure there is an adequate space so that the resident can easily be seen on the video call. If something does go wrong and you get disconnected, you'll either be phoned back or sent a new link through. Accurx is generally used by GP surgeries for video consultations. You will receive a text or an email with the link to the consultation, like the example you can see here. The link is highlighted in blue and underlined. Click the link to start the video consultation. The first screen that opens will check whether your camera and microphone are switched on. If they're not, as you can see here, you'll need to change these settings by selecting the Request Permissions button at the bottom of the page. You'll then be taken to the settings where you can switch the camera and microphone on and allow permission to access these. Once these settings are turned on, you'll be able to join the video meeting. The screen will be divided in two so that you can see both yourself and the clinician on the screen, and you can begin your consultation. Attend Anywhere is used by many hospitals to undertake video consultations with patients. Watch the short video to find out more.
Getting to an appointment can often be time-consuming and tiring. But many services are now offering appointments using a video call, just like Skype or FaceTime. This allows you to see your clinician from the convenience of your own home, local centre or workplace. It has been designed to be easy to use, with just a few simple steps to get going. You might be sent an appointment letter from the hospital or receive an email or text message from the GP surgery or other service. This will include details of your appointment and a web address to enter into your browser. You can use a desktop computer, tablet, laptop or smartphone. Just make sure it has a webcam, microphone, speakers or headphones, and a reasonable internet connection. It is a good idea to test everything a few days before your appointment. If you are using a computer or laptop, use the link you have been given and click the Test Call button. This will take you through some checks to make sure everything will work on the day. You will need to use the Chrome browser on Windows-based computers and Android devices, or the Safari browser on Apple devices. If you don't have Chrome on your Windows computer, you will need to install it first. It's free to download. If you don't have suitable equipment or you can't get it to work, phone the number on your letter or get in contact with the clinic. They might be able to arrange some help for you to use a computer in your local centre, or they will ask you to come in instead. Wherever you choose to make your video call, you'll need to make sure it is private, quiet, and well lit. But avoid a bright light or sunshine behind you, just as if you're taking a photo. Though if you're using a smartphone or tablet, try to keep it as steady as possible. Prop it up and leave your hands free for something more important. A couple of minutes before your appointment is due to start, click on the Start Video Call button. The system will run through some checks to make sure everything is working. Then it will ask for your name, phone number and date of birth. This is only so the clinician knows who is calling. Your details won't be kept. You will then go into your own private video room. All you have to do then is wait. When they are ready to see you, they will join you in the video room and your appointment will go ahead as normal. If for any reason the sound or picture starts to break up or the call drops, simply click the refresh button at the top of the screen. This restarts the call exactly where you left off. If you can't get the video call to connect properly, or if you've been waiting too long without seeing anyone, phone the number on your screen or letter or contact the clinic. But try not to hang up your video call in case they are just running late. At the end of your consultation, just say goodbye, and if necessary, click the end button on the screen. Attending your appointment using a video call gives you access to the same high standard of care without the disruption of travelling, saving you time, energy and money, and saving the environment too.
So now we've looked at two of the most commonly used video consultation methods, we'll move on to policy. You need to review your policy to include video consultations as a way in which residents can receive care from their healthcare professionals. In considering what would the resident require in a standard GP consultation, there is not much difference when carrying out the consultation over video. The same principles of the resident's dignity apply, and extra consideration needs to be made around where the video consultation is taking place, making sure it is confidential and comfortable, and considering if the video consultation is appropriate, for example, if intimate areas need to be examined. We've included some guidance here on the principles for intimate clinical assessments undertaken remotely, and it's worth having a read through this when considering adding things to your policies. Here are some commonly asked questions and answers for using video consultations. Are video calls secure? Yes, they are secure and your privacy is protected. You are sent an individual link and will have your own private video room that only authorised clinicians can enter. Is an app needed for video consultations? No, there is no app for the video consultations that have been detailed in this presentation. They are all completed through an internet browser such as Chrome or Safari, so you do not need to download any apps. How much will the video call cost? The video call is free, excluding the usual charges for using the internet on your device. How much internet data will I use? You don't use any data whilst waiting for a clinician to join you. A video call uses a similar amount of data to Skype or FaceTime. Top tip: if you can connect to a secured and trusted Wi-Fi network, such as at home or work, this will avoid using your mobile data allowance. Are there only 2 programs for video consultations? No, these are just the most commonly used in health currently. We've now reached the end of this clinical video consultations training session for care homes. Please do check our website regularly for further information and updates, and there is a link for this on the screen now. We've also included links here to access the Attend Anywhere video and to access our other recorded training sessions via our YouTube channel. If you would like to request a one-to-one session for any of our training sessions, please don't hesitate to get in touch with the Design and Learning Centre, and we'd be happy to go through this with you. Thank you for watching, and we hope you found this session useful.